Okay, the first of the A, or the first step in approach to the emergency situation, is the assessment. In assessment, there are few things or few important things that we need to look into. The first thing is that hazards. Is there any hazard? Two, extra resources, extra help that we need to mitigate the situation. Three, what is the number of victims? Four, the type of emergency situations. Five, accessibility to the victim. And six, mechanism of injury. So in short, remember this is hentam. Alright, Hentam. So just hentam it. Now, let's look each one. Hazard. Hazard is a condition that can cause harm to us, and our aim in facing hazard during assessment is to identify it and basically how to mitigate it, or how to make the situation safe by removing the hazards if possible, or minimizing the hazard. Examples in the situations of water injuries. Okay, water itself in this situation is a hazard, so it's best if we not to go into the water, or if we want to go into the water, we might need to do something in order to make it safer by basically carrying some buoyancy vest or buoyancy aid. Now, if it's a situation or someone who is actually in the pool and he get there because of some electrocution and there's wire lying around, then it's best to switch off and make the area safe before we're going into the pool. In terms of extra resources or help, it can be divided into two. One is equipment, the next is services. In terms of equipment, things like rope, bag, or flotation device can be used to help in the victim. In terms of services, definitely we need to call the ambulance to get help, or even the fire and rescue in a more complicated situation, or the police to control the safety. Knowing the number of victims is important. One victim goes into the water and basically he's having a situation like crime or something. Well, it is okay. Find that we or maybe a few other people can help him. But a boat capsized carrying more than 20 people or 30 people, then we have a bigger group of rescue party to come in and help. The type of incident or the type of accident can happen is also important. Is it cram, or is it someone basically fall from fight into the water and loss of consciousness? It's important for us to know. Accessibility is also another thing to the victim. What is the best and the safest way to get access to the victim? Do we need to carry something to the victim, or is there a better way of getting him out of the pool, or by using just a rope or a stick? That is also something to consider. The mechanism of injury also is important for us to know in assessments. Example, someone who's basically was swimming and he's basically drowned because he got tired. That is a different way how we're going to handle that compared to someone who basically goes and jump from a height and cause a diving injury. We have to basically suspect of cervical injury, something like that. So basically knowing the mechanism injury a little bit is important when we want to approach to this victim.